Okay, good afternoon.
Good afternoon.
Okay, children. So today we are going to see one interesting topic which will really boost your skills in related to calculations, and which is very essential when you are doing it near to the bedside of the patient. So here I would like to give a clue before going into what topic we are going to see. So the clue is that this particular procedure is being done when the patient is in inpatient, that is when he is getting admitted, and might be when his fluids are getting dropping down, or might be the electrolyte balances are down, or in certain cases where the patient's blood products, any WBC, RBC, those blood transfusions are delayed. In those cases also we will be starting this particular procedure in order to make the maintaining of the normal volume of blood. So, what procedure we will be doing for all the cases who is having fluid and electrolyte imbalances? Yes, can you please? IV cannulation. Yes, very good. Clap hands for it. So it's IV cannulation. So here we are not going to see in depth about the IV cannulation, but when we start with the IV cannulation, in order to maintain the fluid and electrolyte balances in the body, we will be going for another procedure before we start into any patient, because all the clients are individual. For example, can you tell me your weight? 50. Thank you. Your weight 50. And your weight 32. So there is some changes in the weight of a client. So just imagine in ourselves itself we have different weight, different height. So similarly in a patient also we cannot give mildly the full dosage. It can be toxicity. So to prevent all these, that is to prevent the volume overload, what we do in our nursing is that we will be doing the IV fluid calculation. So before going into IV fluid calculation, of course you know we will be starting with IV cannulation. So that tray I have been set up over here. So mostly you will be having spirit, okay, and then you will be having cotton balls, and then to fix the cannula we will be using the plaster, elasto plaster, and then as this is a sterile procedure we can use gloves, and then we need different sizes of cannula before we start the procedure. So yes, you have done all the cannulation, you have started the IV line and you have connected the IV tubings into the NS or might be any fluid. So you have different types of fluid which I will be telling you later. Okay. So we will be connecting this particular set which we call it as macro IV set. Can you repeat what is this?
Macro IV set.
Yes. So this macro IV set will be connected and we will be starting the fluid. So before we start with the cannulation or we do anything, as I told you, we will be checking the height and weight of the patient as well as what is the condition of the patient. So we cannot go and give large amount of fluid at once. For example, you think a patient is being cannulated with this IV cannula, and then the doctor has ordered 500 ml of normal saline to be infused. So if the time hour of infusion is not given, or if a clear-cut idea is not given, what we will do? We will rush the fluid at once, 500 ml. But that 500 ml rushing into the body at a stretch will increase the volume. So normally our body, adult body water content should be around 70%. So if you give suddenly a large amount of fluid into the body at once without calculation, what will happen? The heart will be now compensating or will be trying to pump very hardly, because large amount of fluid 500 ml is going and pouring into the IV line, which in turn returns into the heart. So in the chamber, that is the left chamber, now will be deprived or will be trying to struggle to do the pumping mechanism. So that is why, to prevent the fluid volume overload or to prevent the fluid excess shock, for that case, hypervolemic state, we do a procedure called as IV fluid calculation. So today we are going to see about IV fluid calculation. So before going into the IV fluid calculation, you should know what are the different types of fluids are there. Are you earlier aware of any kind of fluids? Is from type A. Any fluids which you know? What's it? NS. So you call it as normal saline. Any other fluids you know?
DNS.
DNS, dextrose normal saline. So just to simplify all these NS and DNS, you're getting confused. We can divide into three major categories, which is they have classified into three major classifications. One is isotonic, hypotonic, hypertonic. Don't get confused with what is all these tonics are. Tonic is nothing but the density, or we call it as the thickness of the fluid. So in iso means which is a neutral fluid. So for patients who are receiving isotonic will be having 0.9% of normal saline. And in hypotonic, patient will be receiving a little lesser percentage of normal saline, which is 0.45% of NS, normal saline. And then in case of a hypertonic solution, the patient will be receiving 3.45% of normal saline. So these percentages will we are not going to go in depth as of today. So today we are going to see like there are different kinds of fluids where it will be following DNS with NS will be following on hypertonic, or patient who are having sodium level less in their bloodstream. As I told you, electrolyte imbalances. For those cases, we will be choosing hypertonic. Anyway, this will be decided by the physician or the consultant who is going to give the transfusion. But before that, we have to know what are the types of fluids. So these are the common fluids, and along with this, we also give blood and blood products or blood plasma volume expanders. So what is plasma volume expanders in the sense? Might be if a client is not receiving blood immediately, if it is delayed, we don't know what is the blood group of the client, then until the blood has received, we can give this transfusion called as plasma volume expanders. We call it short as plasma volume expanders can be given. So this is also a sort of IV fluid. So these four IV fluids, if you know, you can easily manage in an emergency room or in an ICU. So now coming to the calculation, as our topic is on calculation. So how do we do the calculations? So here the calculation they are dropped in with a small chart. So here you can, with the help of the chart, you will be easily able to understand. I will give you two, of which you will be performing in the later, but just have the formula with both the teams, and I will tell you when to do, don't do it now. So the first is that how do you calculate the drop factor? So you may ask me one question, ma'am, what is this drop factor? You have that query, right? So drop factor is nothing but the IV chamber. So in this, I'll just open and show you.
Nine seconds.
So in this, you have the chamber, this pass this one. So you have a drip chamber over here, and this drip chamber only we call it as the drop. So this is a macro drip chamber. So here you have different types of drops. So you have to read the package before you open. In the sense, in some of the sets they would have given how many drops. So here also they have given 1 ml is equal to 15 drops. Just go through and pass it to the other team as well. In certain drop factors, it will be 10 drops, 20 drops, 60 drops. So always read the reading before you open. So then you can calculate. So before doing the calculation only you have to, so before opening itself you have to see what drop factor you are going to connect to the patient. So for adult all we go for 50. For a pediatric we go for another set which we call as micro drops. So micro drops is always 60 drops per minute, which will be equal to 1 ml. 60 drops is equal to 1 ml. So here the 15 drops which is going to pour into the drip chamber will be equal to 1 ml. So that's the calculation. So drop factor very essential before you start the IV calculation. So how do you do the calculation? The calculation will be how many dose you are going to calculate, dose per minute. So yes, from A group, can you come and write the first one, that is what I have given there on the board. Is yourself. Thank you. So here what she has written in the formula is that the amount of fluid which is to be infused into the drop factor. The drop factor only I was going on speaking. Just go through the package. Whatever drops is given, 1 ml is equal to 15, then 15 must be over here. If your packet is showing that if the rate person is changed, might be 20 drops per minute or 10 drops per minute, then we have to put this drop factor as 10 or 20. So this is not fixed. We cannot fix the drop factor. So you can only fix the drop factor on what the patient is being connected. Be clear with it. And then once if you are fixed, yes, today we are having 15 drop factor, so we can take this 15 drop factor. And for example, if my patient Mr. X wanted to be infused around 500 ml of fluid, so 500 into the drop factor which we are having over here is what? 15 divided by the total time. So total time might be the doctor himself will be giving over 3 hours, over 2 hours. So that infusion time, so if it is 3, you have to put 3. So as this is in hours, we have to convert into minutes because we are going to perfuse or we are going to purge the fluid through minutes calculation. So that's the reason why the 60 has come. So into 60. So this calculation will give you the how many dosage is needed by the clot. So likewise, so in case if the patient is having 60 drops per minute, what we can do? Patient will be receiving 60. And if it is over 6 hours infusion, then if you do the calculation, 60 get cuts, then this is 50 drops per minute. GTT is what is it? GTT means it is drop per minute. So, and this is 300. So I have given team A and B to they can do it on their own. So you just try this on your own. You can apply, and if you have doubts, please ask me. Team A and team B. If you have any doubts, please raise your hands. Do it slowly so that you can do it correctly. Don't be in a hurry. can discuss and do not an issue. So it's your turn. Okay, I can help you out. What is the question which we have given them? Team A. So what is the total amount of fluid infused? 500. So you can put 500 over here. And what is the drop factor which they have given? 60. Okay. Hour of infusion? 12 hours into 60. So this 60 gets cancelled. So 12, how many times? Okay, we want 2 tables. So 3 divided by 1. So which is around, you can round the number which is 42 drops, right? Team B, I hope with the answers. What else? Still struggling. Okay, now tell me the infusion. What is the volume of infusion? 500. Okay. What is the drop factor? 20. How many hours? 5 hours. 5 hours into 60. So 3 divided by 100. This is 33.3 drop. This is answer. You are all a little weak in calculation. So try to take, as it is a new portion, might be a struggling. Try to do number of calculations with different types of using different factors, that is drop factor, using the different change, you can change yourself. Maybe 1000 ml of fluid, increase the fluid, increase the time or decrease the time, and try to do repeated calculation so that it will be easy for your future when you are doing at the exam. Any doubts in this? Okay. To conclude the topic, I would like to say that can be certain variable factors, that is influencing factors, to interrupt this procedure. Like for example, you have done the calculation, you have checked what packet of fluid we are going to use, how many ml we are going to use, what is the drop factor, everything. And you have also selected the size of the cannula as well. But there are 3 major factors which may disturb the fluid calculation. One is that the height of the fluid which we are going to get. So normally it should be about 45 centimeters above from the end. In case if it is too high or too low, if it is too high, the fluid will be rushing very faster. If it is too low, the fluid will be going very slow. Maybe you would have calculated 8 a.m. the patient you have started the consultation, and might be by 3 o'clock you have to end the infusion. If it is too low, the 3 o'clock infusion to be ended might be extend up to 6 o'clock in the night, in the evening. Similarly, if it is too high, what happens? Fluid will be going very fast. What happens? Instead of ending at 3 o'clock, 3 p.m., the fluid would have got over by 1 p.m. which is fluid volume over. So fluid volume overload is also a big complication to the client, and fluid less is also a critical condition. That's the reason the height of the solution, that is the IV stand which we are going to place onto the head end of the patient, also plays a major variable in transfusion of medications or infusions. The next important point is that position of the cannula. So how we are going to place the cannula. So in certain instances what they do is that the cannula might be near the joint surfaces, which is very unethical. We cannot place on the joint surfaces. Or if it is going to be placed on the arch of the vein, that is one vein and another vein coming and joining into the particular part. If you are going to place the tip of the cannula there, that also will hinder the procedure. Hinder means it is not going to help for continuous fluid of infusion. So that's the reason where the cannula is placed also play a major role, and the size of the cannula. You wanted to give large infusions and you go for a smaller gauge. Will it go very fast? No. So according to the need of the client, according to the emergency situation, we will be deciding the size of the cannula. So that is also playing the second important factor variable which will be influencing the calculation through IV fluid infusions. And the last important factor which will be influencing more majorly is that the clot. The clot which is being developed into the IV site itself, which we call it as hematoma. So if that is a hematoma and if there is no clear passage of the fluids, in spite of your n number of calculations, what happens? The fluid is not infusing properly. So whenever you do the calculation, immediately you check the height as well as what size of cannula you have selected according to the emergency situation, and see whether the line is patent. So before starting the infusion, only what you have to do? You have to give at least 10 ml flush to the IV line, and if the line is patent, then start with the infusions. Is that clear? Will you all do it in your bedside clinic? Yes. Thank you. Any doubts? Thank you. See you in the next class.